Hi, Dr. Pim. I've been hearing about Ozempic for a bit. What is Ozempic?
Ozempic. Actually, Ozempic it's a medication for diabetes actually, but it's in a form of a pen, and people are using this for diabetes, but also there's an indication for weight loss as well.
So anyone can take it?
Anyone can take it, not necessarily anyone. So there are certainly some contraindications. For example, if you have anything related to thyroid cancer in your background or in your family, or tumors or cancers related to the endocrine system, such a those kind of thing, we don't recommend you to take it. Also, there are also other stuff that we need to get you tested before we actually recommend you to use this medication.
So what's the process for actually getting Ozempic? Is it having a doctor's consultation first?
So if you're interested in getting a Ozempic, you should have a consultation first. So first of all, we would recommend you get a blood test after the consultation. So say you want to get Ozempic, you'll come see me and we can have a little consultation. I can see where you're at, about your background, your risk factors, and I'll prescribe some blood tests just to make sure that your baseline is okay, that you're a suitable candidate to get Ozempic. And then you'll go ahead and do those blood tests. Afterwards, when we get the result, then we'll come back and we'll have another discussion to see if you're still suitable, because maybe you're no longer suitable according to a blood test, who knows. And then once that is settled and you still want to pursue with the Ozempic, we have a little chat and I'll select the dose that I think is suitable for you, and that will be your first pen.
And do I self-inject that pen? Or what if people are not comfortable to inject the pen themselves?
When you get your first pen, so the pen can be delivered to your house, to your place, and then we're going to have another consultation when you get the pen. Through this video call, I will be telling you about how to self-inject yourself, the whole process, how to prep the pen, how to test the pen, and which area, what location, how deep, about changing needles, everything. So that should be a rather smooth process.
Is there a nurse that can actually come around and help us with that injection? Or is there, do you only have to self-inject it?
So if you're not comfortable injecting yourself, like we do also have nurses from the clinic that can go and help deliver these injections for you. That's also one possibility, or if you need any sort of assistance.
Are there alternatives to Ozempic that's probably oral or an oral tablet instead of an injection for people who aren't comfortable with it?
So actually, first of all, it depends what's your aim at taking Ozempic, right? Because as I said, actually Ozempic is a medication for diabetes. So in treating diabetes, there are many groups of medication. Now, each group is suitable for different types of people, different types of patient. So certainly there are many types of oral medication. There are other types of injections as well. So this is something that we should be discussing between the general practitioner and the patient about what might be the suitable thing for you.
Are there side effects for Ozempic or its alternatives?
Certainly, there are certainly side effects. So the most common side effects for Ozempic is mainly about the gastrointestinal stuff. So bloating, feeling fullness, a little bit of stomach cramps. So those are the most common side effects that people get.
Okay, I think this has been very informative. Thank you, Dr. Tel.